Welcome to Mama Toto Docs. I'm Dr. Martha, the pediatrician.
And I'm Dr. Lisa, the obstetrician.
And we're Dr. Moms. Today's topic, we're going to be discussing contraceptives in the postpartum period.
Yeah.
So, Lisa, when should a mother who has just had her baby go for contraceptive care?
So what we usually do is 6 weeks after delivery, whichever delivery is when we have the discussion.
Okay.
That's because for some women, especially those who are not breastfeeding, their menses can return as early as that. In fact, even a bit earlier, but we use 6 weeks as the mark.
Okay.
Yeah, so we say 6 weeks postpartum, come in for a visit, go see your gynecologist, and then now we have that discussion surrounding contraception and so on.
Okay.
So it's usually 6 weeks.
And what are the different kinds of contraceptions available?
Because now it's different. Postpartum, some of the methods are allowed, some are not. When we look especially at breastfeeding mothers, we look at their hormonal options and their non-hormonal options. Yeah. So we'll talk about the non-hormonal first.
Okay.
And the most common one, first of all, safe days, which we say safe days are not safe.
Okay.
You're breastfeeding, you're not sure when your periods really started, you don't know how the new cycle is going to be. So not for everyone is the cycle completely, back to 28 days and so on. So you can't choose safe days. So in that case, there's no such thing as safe days. It's really at the bottom of the list.
Yeah.
For breastfeeding moms, there's what we call lactation amenorrhea method, which is basically the breastfeeding which suppresses the hormones and helps someone not to ovulate. It's actually 98% effective.
Okay.
However, this is only if someone is less than 6 months into their breastfeeding, they're exclusively breastfeeding, they're not taking long breaks from their baby between breastfeeding, so less than 4-hour feeds and so on. You can assume that it is safe, but still we say 6 weeks to be sure, although it can go on for even 8 to 9 months. Yeah.
Okay.
Those are the conditions around it, that if you have been breastfeeding for less than 6 months and if the breaks in between you feeding your baby are less than 4 hours.
Okay.
Yeah, which doesn't happen for so many of us.
Yeah.
Just because you go back to work after 3 months, or you're taking a break for whatever reason, or you're doing mixed feeding, so you're doing breastfeeding and you're also doing formula feeding as well. Yeah, there's a difference there.
Okay. You repeated what I wanted to say.
Yes,
I just needed you to clarify that it's up to 6 months when it's most effective.
Yes.
And you have to be exclusively breastfeeding and not more than 4-hour breaks.
Yeah, not more than 4-hour breaks.
Okay.
Yeah.
All right.
Yeah.
And by the 4-hour breaks, what do you mean?
So in between now the feeding of the child. Yeah. But of course, now if you think about it, maybe if you pump.
Yeah.
So it's not that literally breastfeeding the child, if you're pumping in between.
Like if you're pumping at work.
Yeah, that can still
work.
Yeah, that can still work, but it doesn't work for everybody. That's why we advise everyone to just come 6 weeks postpartum, no matter when their period was going to start or not going to start.
Okay.
So the other non-hormonal option is putting in the copper coil. So a coil, basically the copper one, it doesn't have hormone, it has copper. We put it in vaginally, it goes into the uterus, and then it sits there.
Okay.
Yeah. And there now it prevents pregnancy from happening in a variety of ways.
Okay.
That's also quite safe, and we usually say do it after 6 weeks because the uterus has gone back to size, and so now you can put the normal copper IUD in.
Okay.
There are still some that you can put immediately after birth. They're usually longer. There are postpartum coils that you can put in. The only issue is if you imagine that the uterus is big, someone is bleeding a lot, it's very easy for that copper or the coil to just be removed or to be expelled.
Yeah.
So that rate of it being expelled is a bit higher. So we still advise the 6 weeks. But if someone wants to start immediately, that's okay.
And how effective is it?
Yeah.
Is there a high failure rate for the coil?
No. It's less than 1% chance of it failing if it's correctly placed. And then if someone also checks. So what we advise is you check after it has been placed, just to be sure it's in the right place.
Yeah.
And then a month after your periods have come, again, just do a pelvic ultrasound scan to check if it's still in the right place. And then from then on, if possible, someone can be feeling for the threads.
Right.
To see if they're still there.
Okay.
Yeah, to be sure that it is still very effective. That's the copper. So those are the non-hormonal we discussed.
And do you get instances where mothers are allergic to copper or react to?
I'm sure there's such
them?
cases, but they're not common. So like
Okay.
I haven't encountered
Yeah.
that, but I'm sure there are such cases, and maybe they already know from
Okay.
before.
Okay.
Yeah.
Okay.
But
So are there
remembering it's
other
a very
options?
small amount.
It's a very small
Yeah,
amount.
yeah.
Okay.
So for non-hormonal, it's only copper, but there are other coils. There's a hormonal one. It has different, so it has progesterone basically on it. So same concept, we put it through the vagina into the uterus, and it has hormone that it is discharging during that time. The goodness with this, and that's why we also say that it is safe, is that a very small percentage of that hormone gets into the body system. Yeah. And so when that happens, then the side effects that people would get if they have hormone in their system, is a lot less.
Okay.
Yeah, so that's also an option for some people who, and we'll discuss the side effects. So like the copper IUD, some of the side effects are the periods can be longer or they can be heavier. So if you already have heavy bleeding and then you put in the copper, you find a case where you're really bleeding a lot, which can also increase the risk of it just coming out. So, and they don't want hormone in their system, we give them the option of having the hormonal IUD in, which will now help with that bleeding to be less. Yeah.
Okay.
Yeah. So that's another option. Again, 6 weeks, again safe.
Okay.
Postpartum.
Okay.
So then now we move to hormonal options. Now the hormonal options, we think about like progesterone. That's the safest, especially for breastfeeding moms, because the other ones that people use, like Yasmin, like Femiplan, and so on, those are what we call combined.
Yes.
So they have estrogen and they have progesterone. And then there are some that only have progesterone, so something like Microlute. There are certain pills that we know only have progesterone. Those ones are safe in breastfeeding moms, because now we know that the progesterone is safe for the baby. We don't know how the effects of estrogen will be on the baby, because some amounts do pass to the baby during breastfeeding.
Okay.
So for breastfeeding moms, before 6 months, we give them progesterone only contraception. And so in that, there are different types. There's the progesterone only pills. And those pills now, someone takes them every single day at almost the same time. There are different types, but for most of them, you only have a 3 to 4 hour window.
Okay.
Where you can. So if I'm taking at 8 a.m. every day, I'm taking at 8 a.m.
Okay.
If I try to do 8 a.m. and then 6 p.m. the next day, that's already considered like you've missed a pill. Yeah, so it's that strict.
Okay.
Take it every single day. And we wouldn't recommend it in someone who's going to forget.
Yes.
Yeah, to take the pill. Who won't be, because then it's not as effective.
Yeah.
And you find there are a number of women who just don't want that, just because they know they're not going to remember.
Yeah, and that's why we want people to come and see their gynecologist, so that they can discuss the options available. Because it's not a one size fits all.
Exactly that. So there's that pill. And then now we have the implants, where now we put a progesterone implant in the arm, on the inner part of the arm, and it stays there for 3 years. It still does the same work. The goodness is you forget about it. So it's there in your arm and you forget about it for 3 years if you want, or whenever you want to remove it, and then that's it. So there's that option. There's an injection, progesterone only injection, that women get every 3 months. We'll still discuss now those side effects as well.
Okay.
So that's also another option there. And then we discuss the coil that is progesterone.
Yeah.
So those are the hormonal options, are progesterone only. Non-hormonal are the ones now we've talked about. Safe days, we've talked about breastfeeding, amenorrhea, we've talked about the copper IUD. And then of course there are condoms and so on that people can try. But all of those are at the bottom. Safe days, condoms, withdrawal, all of those are at the bottom of the pyramid. Yeah, they're not as effective.
But on the note of condoms, maybe you can talk about, it's a form of barrier protection and its importance in preventing STIs, sexually transmitted infections.
Yes.
Especially in the postpartum. Is there a role
There is a role, especially if, I mean, it's a bit tricky, but we do say that all these forms of contraception do not prevent STIs. So the pill doesn't prevent, the IUD doesn't prevent, all they're doing is preventing pregnancy.
Yeah.
But when you look at, for example, now condoms, they also have the advantage of preventing STIs as well.
Yeah.
So it's something that one has to weigh and see. Yeah. But just to keep that in mind.
Yeah.
Yeah. Of course, the assumption is you and your partner are being faithful to each other.
Yeah.
So you can live without the condom, but just keep that in mind. Okay. Yeah. And in doubt, always just use condoms. You have a right. Yeah. You have a right to ask and a right to use one.
So what are the main side effects of the hormonal contraceptives?
So when we look at things like generally, so the pill, again, the implant, the injection, those ones, you find that some people get headaches. Not everyone, but some people get headaches. Some people with migraines actually get triggers of those migraines as well. There can be some mood irritability, so mood swings and so on. Some people can get breast tenderness during that time as well, which can be tricky. And for some people, they can get irregular bleeding. Okay. Yeah. So you find that, okay, you bled, this time, and then 2 weeks later you have a bit of spotting and so on. That one is more common with the implants and with the injection and with the coil. Yeah, so that irregular bleeding that you can't really trace is there. It might not be heavy, but it may be there. Okay. Yeah, as a possible side effect. For the injection, what it's associated with is weight gain. I know people always talk about the pill causing weight gain and everything else, but actually the one that is totally associated with it is that 3-month injection that people get. Yeah. Okay. The rest, some people even have weight loss. So it really just depends on the person. Okay. It's not one, like you said, it's not one size fits all. Yeah, so no one can, like, watching this, it's good to have that information, but doesn't mean that now you go and take whatever you feel is best for you. Yeah. Go see your gynecologist, go to a clinic, go and figure that one out. Yeah, it's very individualized. And then now for the copper, the side effect is that your period may be a bit longer. So if you used to bleed for 3 days, you may bleed for 5 days, or you may have like a brown discharge a week before the period starts and a week after. So that's with that. Or now on the day that you're actually bleeding, if you're using pads and you used to use 2 pads a day, now you might choose 3 to 4. Yeah. So it's something to watch and not to persevere through. Okay. Yeah. So if you're feeling faint, you're feeling dizzy, you're bleeding too heavily, then it's advisable to remove the copper IUD and go for another option, which in this case could be now the hormonal IUD, the hormonal coil. Okay. Yeah, so in general, those are like contraceptives postpartum. It is different. You can't go straight back to your Femiplan or your Yasmin and so on. It's always good to check because these things do pass into breast milk. But it is important because after 6 weeks, you may not be sure when your menses will return. Exactly. Yeah, so anything can happen. Can happen then. In terms of now getting back to getting babies, for people who've had vaginal deliveries that were not traumatic and they feel mentally and emotionally ready, they will be ready anytime from that 6 weeks. So just be sure that and it's okay if they want to. But for people who have had cesarean sections, that's because the uterus has a scar. And scars are usually a bit weaker. We advise that they wait for some time before they conceive again. So contraception is so important. So what is advised is 9 months after is when now you can conceive, so that now you deliver another 9 months after. Then 1.5 years your uterus has rested, ideally. Of course, things happen and things change. It doesn't mean now it's traumatic. It doesn't mean now it's life-threatening. It just means that we work with you closely during your new pregnancy. But it's so important to know 6 weeks, that's the purpose of that visit. And it's important to do what you need to do.
And even from a pediatric point of view, the importance of spacing, that birth spacing, even in terms of giving your baby the right nutrients, even recovery. It's very important for the mother's body to actually recover and come back to baseline. Even mentally, physically, emotionally, spiritually, like just to come back to your set baseline, so that now you're ready and prepared for the next pregnancy. As we have also said, let me throw in this disclaimer: always consult your gynecologist.
Always.
Because each person has their own bodies are different. We've had a really enlightening conversation on contraceptives. If you have any questions or comments, feel free to leave them in the box below. And we look forward to hearing from you. If you have anything you'd like to share, let us know.
Let us know. Anything to add, let us know as well. And also your experiences with
yes, what have you
contraception,
experienced with
postpartum.
contraceptive?
Bye. Subscribe.